Welcome to La Vida Las Vegas podcast. We're two physical therapists living the life in Las Vegas. I'm Dr. Erica.
And I'm Dr. Joe. We created this podcast for two reasons. First, to connect the healthcare, wellness, and fitness communities in Las Vegas. And second, to highlight all the amazing people we've met along the way.
Thank you for listening, and remember to take care of yourself.
Welcome to the show.
Thank you.
If you'd like to introduce yourself and tell us what you do.
Sure. My name is Michelle Oddi. I am a nurse educator, first and foremost, a fitness junkie, and just love working out and educating the nursing community.
So what brought you to Vegas?
Actually, my husband and I moved to Vegas to be closer to my parents. They live in Prescott, Arizona. So we wanted to be able to be close enough to drive to them and visit them more often, but not live in Prescott, Arizona.
And Prescott's one of those places that depending on if you live there or if you visit there, they say it differently. So Prescott or Prescott.
Yes, I always say biscuit.
Yes.
That's what reminds myself to say it the correct way by the people that live there.
So what do you do to spend your time in Vegas?
Well, if I'm not working, I like to work out. So I have newly found CrossFit. It's more of a new love of mine. And then I like to lift weights with my husband. And then Brian and I like to eat lots of good food. So we like to find good places to eat and just relax with our two dogs.
So what's your favorite cheat meal?
Oh, that's such a good one. I'm going to be a little bit more precise. So there is a strip steakhouse at Mandalay Bay, and I love their truffle macaroni and cheese paired with a really yummy steak.
How about any other restaurants that you've recently been to that you enjoyed?
Well, we have been searching for a good pizza place, and I think we might have found it. So, now that you're asking me, I can't remember what it's called, but it's Rock something. It's
Pizza Rock?
Yes, Pizza Rock.
Okay.
Yes. So we found that one, and we actually really enjoy it. So it's pretty good, better than all the other ones that we found here. But I love sushi, so we go to I Love Sushi. I'm on the Henderson side, so that's where that one is.
That one always has really good reviews.
I Love Sushi. Oh my gosh, it's so good.
What kind of things do you like? Rolls? Are you more of a nigiri person?
I like it all.
Yeah.
Yeah. I don't like the fried items. I like the real fish items. So.
And sushi is one of those meals that's so much better to go get it than try and make it yourself.
Oh my gosh, yes.
Just making yourself is a huge pain. We've tried that a couple times before. It's fun. It's good that you have that experience. But I'll gladly go pay for all you can eat sushi instead of making it myself.
I will definitely pay instead of making it myself.
Have you tried to before?
No, and I don't think that it would be that much fun. So yes. I'm gonna stay with paying for somebody else to make it for me.
It's quite the experience because if you look at just the process of making the rice, and you watch how it's classically made, and people spend years just learning how to make.
Oh, I don't doubt it.
Just the rice.
Rice is really important. My mom grew up in Hawaii, so rice is really important to us. Sticky rice is the best. The American mainland rice is not very good. It's real dry and weird.
For sure. So tell us a little bit about your the different things that you do. And your history as well.
Sure. So I'm originally from Pennsylvania, so definitely a transplant into Vegas. Of course, we already talked about that, but started off my nursing career in Children's Hospital at UPMC, a phenomenal health system. Learned a lot of really amazing things there. And then from there, Brian and I just kind of traveled and tried to find out where our home was, where our home base would be that we'd like to live in. So lived in Georgia, South Carolina, Georgia area for a while, and that's where I got into transport nursing. So I specifically did neonatal and pediatric transport nursing for the local children's hospital in Georgia, and then loved it so much that I wanted to specifically do flight nursing only. So I transitioned into that role, working for an EMS company, and we actually moved to Oregon, Medford, Oregon, and I worked for a company there, Mercy Flights. So, and that started my love for being in a helicopter and trauma care and everything like that. My background's all pediatric and neonatal medicine, but I really enjoyed, that's the only time I enjoyed taking care of adults, was in that EMS environment. I don't think that I would really enjoy taking care of adults in an ICU in a hospital. But in the helicopter, it's cool.
Mm-hmm. But it's a shorter amount of time you take care of them.
Shorter amount of time, absolutely. We have some really great drugs and some really cool interventions, and then you hand them off to somebody else to deal with.
It's really the way to go for some of those things. Like,
yes.
So even if you have a bad patient, you're like, I'm really only going to see it for like an hour, maybe a little bit more.
Yeah.
So it's not too bad. But what made you decide I'm going to go get on that helicopter and that's going to be part of my job skill set?
I was working in a PICU in South Carolina, Georgia, and in a pediatric ICU. And one of the managers came up to me and they were like, we really need somebody for our transport team. And I was like, oh, well, I had never really thought about that. So they trained me for it. And I just immediately fell in love with the autonomy that you have as a nurse to be able to make the decisions and to have that ability to decide what kind of care is best for that patient and to do those assessments and rapidly understand what's going on. So that moment in my career is really what was a main changer for me and really made me into the nurse that I am today, because in transport nursing and flight medicine, you really have to know what's going on. You really have to have a great knowledge base. You really have to be able to handle stress and quickly assess something and decide what's the best intervention. You can't call somebody else. It's you and your partner, and that is it. So that is just what I thrived on for so many years.
And so who would be in your crew?
So it depended. So when I was my first position in Georgia at that children's hospital, I had a respiratory therapist with me, and then the pilot, of course. When I worked for the EMS agency in Oregon, I had a paramedic with me, and then the pilot. When I worked for CalStar Reach, which most people in this area would know because they come into Nevada quite frequently, we were nurse. So I had a nurse with me as my partner.
And does that vary state to state since there's different practice acts and there's
Absolutely.
like different, is it medical directors that would write your rules for what you're operating under in your protocols?
Absolutely. So every EMS agency or transport company has a medical director that writes the policies and the protocols, and especially the protocols for EMS agencies are really important. And it's interesting. California is a really interesting state to practice in because there's so many rules when you cross county lines and all of that. So some of the areas in California, you had to have a medic license to be on board, and some of them you didn't. So it was just, it's a really interesting state to practice in.
That'd be pretty difficult, I'm sure.
Mm-hmm. Absolutely.
So a medic license as an EMT, like paramedic? Okay.
Mm-hmm. Absolutely.
And then so you would have to be in certain areas, like if you flew over one county and then the other county didn't have it, would that kind of go with that, or like how did...
It just depended. So it was all more so where you came out of, but the logistics of it got really kind of crazy. So a lot of our bases that went between Nevada and California, so the Tahoe base, they had to have more of the medic license because Nevada's a little strange about medics being on board also. So it's a really, I wish that EMS would get on the same page across the United States. I think the consistency would really be good for that profession.
Yeah, totally agree.
Yeah.
It makes it easier too, because then if you move somewhere, you have to learn a whole new,
absolutely.
like all the different rules and what you're allowed to do and not do and things like that.
Well, totally, because in Oregon, my medic that was on board with me could do everything that I could do. Practice the exact same way. He could give the same drugs. He could intubate the same way, everything. You come into California and they can't. So they couldn't RSI a patient. They couldn't do some interesting things. So, which is just strange. It's the same license, the same test that you guys take. I don't understand, but.
Yeah, isn't that why they were initially blending that too and having a paramedic and a nurse is to get the combination of skill sets depending on what the state was?
Absolutely. And, you know, it was a really good, that was when I went to Oregon, that was my first time working truly with a medic, which was really good. Again, another good turning point for my knowledge base because medics have such a great trauma experience knowledge base. They understand scene safety, what to do on scenes a lot more than just a nurse from a hospital, right? We've never been in those type of situations when you're just in a hospital all the time. So that is actually a really good thing to have with you.
Yeah, I agree. And I was actually going to bring that up too, is that the skill sets are so different. Like paramedics are not used to operating in the hospital. So there might be certain things that as a nurse, then you would know, like we have to set it up like this because it'll be easier for them either logistically or whatever when they come in. But then as far as the paramedics, they might know other things since they go to people's homes and they go to car accidents. Like there might be other things that they would know to look for that you wouldn't think of just because you're not in the same environment.
Absolutely. And what was cool about that, cool and not so cool, but about the Oregon company was when they had their own 911 system, the EMS agency. So when the 911 system was overwhelmed with all their rigs being out, they would put the flight crew on an ambulance.
Oh, wow.
So I had to drive an ambulance. And we're talking about big box ambulance.
Yeah.
It was interesting. Let's just say that. I mean, if my husband was here, he'd probably be rolling his eyes right now. But I did not like driving an ambulance. It was crazy. You put the minute you put lights and sirens on, people are just stupid.
Oh, no.
They just lose all semblance of reality and they do dumb things.
Yeah, they'll like just hit their brakes when you're driving behind them.
Just in the middle of the road, they'll just hit their brakes. And you're like, what is happening right now? So...
There's certain things you have to do with driving an ambulance, right? So if you're driving certain things, there's different signals, right, that you have to push when you're crossing.
Well, there's different sounds, and the different sounds travel different distances. So if you're like at an intersection, you use like that. I guess it's like a higher pitch sound. Is that right? I can't remember.
Yeah,
how
they
to say
just
it.
want you to change the cadence. So you just have to change the sound. So if you're doing the regular ambulance sound, then if you're at an intersection, they want you to change the sound so that it's a difference, so that maybe somebody would pay attention. It doesn't really make them pay attention, though.
Yeah,
So.
in theory. Because I remember at intersections, we'd always flip it back and forth. And then if you're driving on the road, you'd have the one that goes up and then down because it changes the wavelength. So then that might reach different distances to people. So depending on how close or how far, it might cover that distance because you have a different wavelength and sound going to them.
So as you're driving, is that person controlling that, or the partner next to you is controlling the sounds?
The person driving, because then the other person would be in the back.
Yeah, which was the craziest part of it all, right? So that I would be driving and my partner would be in the back by themselves. Like I get hats off to the medics and the EMTs out there because they should get paid way more than they do.
100%.
Because they are practicing in the back of the ambulance by themselves. And I don't think people understand that because there's just two people in the ambulance. So one is driving. So you have an extremely sick, critical patient in the back, and there's only one provider back there. So sometimes we would steal the firefighters, of course, and they were excellent help. But still, like having your partner with you would be a really good idea at the back.
Especially when people try and fight you because
Yes.
they do a bunch of drugs. There's various reasons why it's probably good to have two people.
Yeah, and just let me tell you that men, when they drink and do drugs, like to drive naked. It's a fact.
Like your EMT partner?
No. Could you imagine? No, but I can't tell you how many people I've scraped off the side of the road that were naked driving. Who drives naked?
I don't know.
And a lot of them would just put one shoe on, a driving shoe.
You got to have
Just
the grip.
the driving shoe.
Well, that's just being smart.
It's just crazy. People are crazy.
Oh, yeah, they are. And that's why when you talk to people, and then sometimes there are rules in place for things, or you try to explain to them, like, not everyone's a normal, rational person like yourself.
Yeah.
Some people do some really weird things. So that's why, history exists, and this is why you have to make rules for certain stuff. So it's interesting.
So when you're working with a partner, how do you delegate those tasks? If, for example, you had a paramedic or an RN that you're partnering with, how do you decide who's doing what, and like what is kind of the thing that you go through your problem solving thing, and who's taking control of those things?
Right. So before we even go on a call, you decide who the primary is of the call. So that person is the person that gets the report, who, depending upon the situation, is doing the main assessment. If we're talking about EMS flight nursing, then you're in charge of the airway, usually as the primary nurse. So a lot of times in California, we would go to car accident sites and the medics would have taken the patient into their ambulance. So we'd get out of the helicopter and go into the ambulance and get a rapid report, and you're doing a rapid assessment and then deciding what needs to be done. And then your partner and you just divvy up the tasks as you go. So if you're intubating the patient, then your partner is the one giving all the drugs while you're getting everything ready.
It's cool because I don't think people realize or appreciate how much stuff goes on behind the scenes to keep you safe. And
it's crazy.
Yeah, it's good though. I'm hoping this gives some people a better appreciation for what nurses do and EMS systems.
Absolutely.
In general.
I mean, because if you think about it, you step in the back of the ambulance and you, within the first 1 minute, you have to make your decision. You need to do your rapid trauma assessment. You have to do your head to toe and see what's really going on and assess the situation. And not even before that, you're really assessing the scene to make sure that it's safe for you. Because if it's not safe for you, then you can't provide the care, so you can't get into that scene. So that's, I know everybody talks about scene safety BSI. That's like the EMS like chant that everybody makes, but it really is legitimately important, especially when you're talking about helicopters, especially when you're talking about car accidents and other vehicles and everything else that can go on, chemical exposures and everything.
And your goal is to not become a patient.
Absolutely. Because if you are a patient, you can't take care of that patient. So, but that transpires into a lot of things in life, right? If you don't take care of yourself, you can't do other things for other people. So that's something that's really important to understand.
And I do actually know a guy that became a patient one time when he was working with somebody. He actually got some nitro paste on his hand and really quickly wasn't able to drive the ambulance and we had to call another unit out to help take care of him. So his partner was taking care of two people at once.
Yeah, that would not be a good situation.
Mm-hmm.
So as far as the trauma kind of system, whoever you call 911, right? So for example, someone gets in a car accident. When is it required to be like, this is where we need the trauma team versus like, just let's rush them to the hospital? Like, when does that come where the flight and the helicopter is needed?
So there's a lot of different things that go into play there. So it depends upon where you are. My base when I worked for CalStar was in Auburn, which is a little bit north of Sacramento if you're going on your way to Tahoe. Mm-hmm. So we did a lot of traumas that way, and sometimes we were auto-dispatched. So we had one county that auto-dispatched us to every car accident there was. So if a car accident call came in, then they immediately auto-dispatched the helicopter to come to it. And then when the medics got to the site, then they would cancel us if we weren't needed. So that sometimes happens depending upon the county. Otherwise, usually the medics will get to the site, they'll assess the situation. And if the patient is unstable, where they need an airway and medications, if they're too far, if the mechanism is too great, also will be another good one. Because if you think about, a lot of people don't understand how rural and far out things can be in California, especially. And then you can say that same thing about Nevada, too. We have very populated areas and then very non-populated areas. So you have all this distance that needs to be traveled to get a patient to the trauma center. So, and that's really the best care that patient can get, is getting them to the trauma center if they've been involved in a significant mechanism trauma. And then also pediatric patients. I mean, the number one way for survival for a pediatric patient is to get them to a children's hospital. I can't remember what the actual statistics is, but it's a significant difference in survival rates of them actually being taken care of in a children's hospital, let alone just an adult, like regular community hospital. So those are other reasons.
So what are some of the differences between kids and adults that you would get into as far as to explain why that would be a significant difference?
Kids are so different. A lot of people like to say that kids are just small adults, and that's completely false information. Kids, first of all, one of the biggest things is that their drug dosages are very different. So we do everything based on kilos. We have gone a little bit more into that genre with adult care, doing some things more based on weight. But for the most part, kids are very based on weight. So that's a different thing. Kids also respond differently, and they do really well keeping themselves stable, and then they kind of dive off because they don't have the mechanism to be able to keep their blood pressure up, to keep everything going for a long period of time. So they'll do really well, really well, really well. And then I like to say they dive off the cliff. And once they get to that point where they can't compensate anymore, then you're really in a tailspin that is very difficult to turn back time with. Whereas an adult, it's a little bit different. They can control their heart rate a lot better. They can constrict their blood vessels a lot better. They can do a lot of different things in your actual body because you're just more mature in that aspect than a pediatric patient could. It's all heart rate based for them. And the minute they can't do that tachycardia, then they're really bad shape. So.
And what if there's multiple people? How many people can fit patients-wise in a helicopter? How do you kind of navigate a really big situation? How do you kind of go through that triage?
That's a really great question. So the helicopter that I flew in initially was a BoCal, which is the same thing that Red Bull uses. So
Red Bull, like the energy drink?
Yes.
Okay.
So that was the style of helicopter that we utilized. Amazing helicopter for lift in the high mountains. Obviously, you can see with Red Bull, they can do amazing tricks with. So we could get amazing lift and be able to have more weight on our helicopter than maybe a normal helicopter would, especially with heat, because heat makes it more difficult to take off with weight on your aircraft too. So we could fit 2 patients in the back of that helicopter. We would have to get rid of a couple of things to be able to fit them both into the back. The problem is that the one patient is a little bit more difficult to get to. So we typically did not like to do that. It would be a total mass casualty situation that we would end up doing that. It's more likely, because it's a more helicopter-rich environment, that we would be able to have multiple helicopters on scene to be able to take different patients to different locations. The sheriff's department and the police departments all have helicopters. Most of them have a medic with their helicopters, so they also did a really amazing job coordinating with us and everything. So.
Very cool. It's good to hear that all those different groups would be able to work together to do the same job. That's really impressive.
But also listening to that, I'm like, man, as a manager or like logistical person to handle those situations in 24/7, probably you want to be able to respond. And what's the respond rate that you're expected to see?
Time-wise?
Yeah.
So when we would get toned out, we had to be down to the helicopter within minutes. So even if you're in a dead sleep, you had to jump up and throw on your suit and get down there. So a very, very fast time response for an EMS helicopter. Now, when you're talking about more critical care, when I was doing pediatric transport, we had to be out of the hospital within 20 minutes, was kind of the guiding point with all of the accrediting bodies. So the faster you're out, the better, because you know that you're going to provide them the care that they need. So you're being called for a reason is the thing. So you need to get there to be able to provide the assistance to that community hospital, because they did a really good job calling you.
So after you did the flight nursing, where'd you go on from there?
So I transitioned from doing EMS flight to just doing pediatric and neonatal flight again for UC Davis Medical Center. So I worked for them for quite a long time, specifically only doing that. And during that whole time frame, I've been really involved with education. So when I worked at CalStar, I did a lot of the pediatric education because my whole background was pediatrics. And typically, flight nurses and medics don't have a significant background in pediatric medicine. So that's something that needs to be brought to them. So that's what I was able to do there. And then I was just really involved in our education for our team when I worked at UC Davis. So, and then from there, I ended up getting my PhD while I was at UC Davis and decided that I really wanted to focus my efforts on education. So that's kind of how I got involved in nurse education, and we moved out here.
Did you go to UC Davis for your doctorate program?
No, I didn't. I went to an online school. It's called North Central University.
Okay. I just like, because I went to UC Davis for undergrad, so I always get really happy when I hear UC Davis.
Yes, it's a great health system. It is too. It's a good school, and it's also a good health system. They have a really nice program there.
As far as like, it sounds like it's like really niched down in terms of pediatric transport, right? So how do people tend to get into that if they're interested in pursuing that route? And how challenging is it in general to get that education, and kind of tell us about what that process is like?
Yeah, absolutely. So typically people get into pediatric and neonatal flight medicine by starting their careers or being in the pediatric ICU or the neonatal ICU. Sometimes you get pediatric emergency room nurses too that get involved and want to. But the really important thing for an emergency room nurse is getting some of that more ICU level care, because typically when you're working as that pediatric and neonatal transport team, you're doing critical care in the helicopter or in the ambulance. You're going to get that patient, you're stabilizing them, and you're providing that ICU to them and bringing them back to the ICU, if that makes sense. So more like a mobile ICU, more so than that rapid trauma assessment and trauma care that regular EMS flight nursing is. So that's why an emergency room nurse really should have some more ICU level care background. But after that, it's just getting them into a program and giving them a really good education to help them foster their abilities to be able to handle the situations. I mean, because you have to know what to do, because you can't just call somebody. When you're up in the air, like you can't just phone a friend and say, "What should I do, doc?" Right?
Send a raven.
Yeah, right. You can't send up smoke signals and say, "What's the right choice here?" You have to make your own choices.
You can't just give them to the stork.
Yeah, I know,
That's
right?
already up in the air.
Right. So could you talk about the difference between an ICU versus a emergency room, just so people know the difference?
Totally. So an emergency room is that immediate care. So let's say you have a really bad car accident. They're going to bring you into the emergency room. They're going to do your rapid assessment. They're going to provide that immediate level care to stabilize you. Emergency room care is all about stabilization. And then you will always go to the ICU after that if you need that intensive care. And an intensive care is more specific. It's more honed into that patient. It's very detail oriented. There's a lot of medications being administered. There's a lot of really intense assessments that are needed to be able to see what's going on with the patient and to provide them the right care that they need to get them, to bridge them to the point where they don't need that significant specialized care.
And what would be an example of like certain things like you see in the hospital that somebody would need in an ICU? If you could give us examples.
So I'll just say adult medicine, because that's typically what most people think, but a cardiac arrest, a heart attack, significant burns on your body could need an ICU. A stroke could need an ICU. Those are all things for the pediatric world. Drownings, near drownings always go into an ICU. Severe allergic reactions will go to an ICU. Those kinds of things. So when you think of the really scary things, that's what goes to an ICU.
Mm-hmm.
They typically have like lower patient to nurse ratios in there. Is it normally like 1-to-1 or 1-to-2 or something like that?
Yeah, so the typical ratio is 2 patients to 1 nurse, unless it's something it's really intense, and then it would be a 1-to-1, so 1 patient, 1 nurse.
In some of those rooms, it's incredible, like how many machines will be hooked up to the person to keep them alive. Like medical technology has progressed so much. It's a lot different than throw them in the back of the Ghostbusters ambulance and then get them to the ER. Like one of my friends worked in ICU, and he was just pointing the different machines that they would connect to people, and it's mind blowing how much stuff you have to know. So I really appreciate people that work in that field.
Yeah, absolutely, and it's something that's ever changing too. I think that's why I love medicine so much, and I love nurse education, is because it's constantly changing. We're constantly having new things come up, new equipment, new research findings that we implement into the field and to really help it bridge that fact. And it's just a constant learning environment. So it's never boring, that's for sure.
So how does that work? Like if they develop some new equipment, I'm sure there's some kind of a testing or trial phase. Are you involved with that? Or is it when that's completed and now they're going to start rolling this out to hospitals, and then do they contact you or?
It depends upon where you work. So a place like UC Davis Medical Center, teaching facility, that level of a facility will do clinical trials. They will have new machines. They will do those kinds of type studies where you might be involved in that. But for places in, let's say, the Las Vegas area, like the HCA system, we don't utilize things until they've been completely approved.
So then what would you do, like as far as if the new equipment comes in, then how do you educate everyone in the hospital? This is how you use this thing.
Right. So it's difficult because there's so many players involved, right? We get a new piece of equipment, and it's not just the nurses who need to know how to use it. It's also the physicians need to know what they can take from it also to be able to provide that care. So it's really using multiple modalities. That's usually how I go about providing education because people learn differently, right? We have people who can read something and they know right away, people who like to touch and be more kinesthetic learners. So being able to provide that education in multiple modalities where there's flyers, there's emails, there's newsletters, there's bulletin boards, there's skills labs where they can come in and touch the equipment and go through simulations with them. All those things are really important before you bring out something, depending upon the level of what it is. So if it's something silly like a new type of wrap or blanket or something like that, not a big deal. It's an easier rollout. If it's a new machine that like we are rolling out an AEEG machine for babies who are being cooled currently. And that machine looks at, just like an EEG would, looks at brain waves of what's going on with the baby so we can see if they're having seizures while they're having them so we can provide better care to them quicker. But the nurses place the leads, and the leads are actually little needles that go into the skin on the head. So something like that is a more intense educational process than something like a new lift machine or something like that, so.
For sure.
So prior to transitioning into flight nursing, had you rode in a helicopter before?
I had not.
No? Okay.
No, my first time was going to a call.
Oh, really?
Yeah, absolutely. It wasn't even like, it was just, let's go. So yeah, that was interesting.
So like, where's the cup holder?
Yeah, I know.
For my
right?
monster.
Yeah, so tell us about that experience. For the first time, your first call, what happened?
Oh, I mean, I was nervous as all get out. But it was cool. I mean, and you get in there and it's a really small environment, very, very small environment to be able to practice. When you're used to big rooms and big ICU units and bays, you get into this really tiny mobile thing that flies in the air. And then you have a helmet on and you're trying to make sure that you're buckled in correctly and that your mic is working and that you're not hot mic'd because you click on and off with a microphone, right? So you don't want to have it in the on position all the time because then everybody gets annoyed with you. So there's all kinds of different things that go through your head, right? So, but no, it was awesome. I'll say the best place that I ever flew was definitely in the Auburn base because we flew into Tahoe all the time. And those Sierra Mountains are just absolutely beautiful. You get super high in elevation. But I had some really amazing pilots too when I flew in Medford. An old military pilot that he was rock solid and you would just take me anywhere because I trust you with everything. Mm-hmm. So...
And that's another consideration, too, is weather, right? So how do you guys navigate? I mean, the pilot obviously probably makes those decisions, but like what things that you were maybe surprised about when you saw those weather conditions that maybe weren't the best? And how would you navigate the weather conditions with the person that you had trying to get them to the destination that you needed to?
Absolutely. So remember, you have 3 crew members. Okay, so 2 nurses and the pilot, or a nurse and medic and a pilot. So we always said it's 3 to say go, 1 to say no. So the pilot, when the call comes in, will do a quick weather check. So he'll see if the weather is good, everything is going fine, and then he'll say okay or not. But we can also say, no, I don't feel comfortable at any time. So total aviation type thing, making sure that everybody's comfortable in the situation. I've been up in the air before and looking out and not seeing something good and saying, I don't feel comfortable right now. And we turned around. The minute that anybody voiced that, we would turn around and go back to base. Because again, if you don't take care of yourself, then you can't take care of somebody else.
Are there any stories that come to mind as far as the flight medic days, maybe something that you learned that was pretty interesting or something that you thought would be beneficial for the listeners to hear, or just cool stories?
I think maybe one of the biggest takeaways from just working in flight medicine is communication and the ability to communicate with your team, and how important that is in not just medicine, but in everything that you do. So that's one of the things that I definitely continue to work on as I continue on with my life is just working on being a good communicator. So skill wise, that probably is something that is really important in flight medicine. Let's see, medicine wise, we talked about it a little bit during the break, but when I worked at CalStar, we started utilizing a drug called TXA, and that drug is great for trauma, hemorrhages from trauma. And patients who are really hypotensive or really low blood pressure because of how they're bleeding out. So this drug is really cool because the military's used it for a while, but mainstream medicine hadn't used it a lot, and especially in the helicopter too. So it really helps with allowing the body to have better clots, basically, so that we can help with how fast they're bleeding out and kind of staunch that. So we did a study on that while I was at CalStar, really showing, it was a retrospective study showing the difference between our patients who received TXA and the patients prior to that, before we had the drug, and their outcomes. And we had significant difference in outcomes, much, much better with that drug. And since then, in the time frame since then, more EMS agencies are utilizing the drug, more hospitals are administering it. We're even using it in postpartum hemorrhages for obstetrical emergencies. So it's a really, really great drug that, like we talked about, came from the military. So all the wonderful things that our military does provide to us.
So as you transition into flight nursing and now kind of your role as an educator, what are things that maybe you wish people knew more about, or like things that you've learned yourself about just the pediatric healthcare system in general?
I think something that I wish more people knew was owning their own practice. I know that sounds kind of weird, but so much nowadays people just want things handed to them, the education handed to them, and they're not willing to seek it out. And that really does a disservice to them. So being in flight medicine and having to have such a critical role and really everything being on your shoulders, the decision, you really had to have a good drive to self-educate yourself in addition to what was provided to you. So that I continue to try to provide to other people, that thought process and that approach at learning. It's really important to, when you see something that you don't know, really seek out more information about it and not just expect somebody to come and just teach you about it. So that is just one of the things.
Mm-hmm.
Another one of your passions is CrossFit. That's how we met. We met you at a gym. So what got you into CrossFit and on this fitness journey that you're on?
So I have a really interesting fitness journey, actually. So when I was younger, all growing up, danced ballet and pretty aggressively danced ballet like every single day, and was in multiple productions, did the Nutcracker every year, worked in a company. And then when I went to school and I became a nurse, I stopped and I focused only on nursing. I did what typical adults do, and actually typical nurses do. I stopped taking care of myself and I focused on taking care of other people as a nurse. So typically when you look at nurses, the main population, we don't take care of ourselves because we're so focused on everybody else and being at work and working night shift, which is horrible for your body, and doing all of that high stress environment. When I lived in California, my friend and I decided that we wanted to, maybe try out this gym that was offering aerial yoga. It's a really crazy story. So aerial yoga is you do
like
yoga.
The Little Mermaid?
No.
Not that aerial?
No, not that aerial. Okay. So you're actually in hammocks and you do yoga in hammocks. It's a really cool thing. You guys actually probably would really enjoy it. Amazing for your spine because you can hang upside down in it, and really good for your lymph nodes. But anyway, so we were there. We did this aerial yoga. You have to have a lot of upper body strength for it. It was crazy. It was hard. I was not in shape whatsoever. I was probably about 40 pounds heavier than I am right now. And while we were there, we noticed that the gym offered other classes. So not CrossFit related, group fitness related. So Les Mills offers a bunch of different group fitness. So BodyPump is something that typically people know of, BodyCombat. Locally, LVAC offers all these classes. So I went to one and I fell in love with it, and I really fell in love with the group fitness atmosphere. So being in the group, being pushed by other people, that energy that you get from being in a group, which is very similar to being in CrossFit too. So just went kind of full force into that. It sparked my love. I ended up getting certified to be a teacher or a coach, or whatever you want to call it, instructor for BodyPump initially, which is weightlifting. So it's a weightlifting group fitness class. And then from there, I just got a whole other bunch of them. So Grit, which is their high intensity interval training class. BodyCombat, I'm certified in it also, which is their mixed martial arts class. Body Jam, which is their dance class. So it's really fun, like hip hop kind of. And then Core, which used to be CX Works, but they changed the name to Core, which is just a 20, 30-minute ab workout, basically. Really awesome workout. So I was really involved in that. I loved my gym there. I loved the owner. She was a Les Mills national presenter and amazing individual. Really sparked my love in fitness again. I had gotten away from it, from dancing for so long, and really didn't take care of myself. So I really started focusing on my fitness in that aspect. Then when we moved here, I kind of felt like I didn't have anything. So I missed my gym. I missed my community. I missed that atmosphere that I had there. And it was really hard to find it here, because even though places like LVAC had Les Mills, it was just different because they're bigger gyms. It's not that small group environment that I was used to. So one of the girls that I work with, Maricel, said, hey, my sister and I are going to this CrossFit class. I really think that you would enjoy it, because she knew how much I love to exercise. I would make them come over and lift in my garage all the time and stuff with me. So I went to CrossFit, and that's the end of the story there. I drank the Kool-Aid, I guess. It's really interesting because my husband is really into fitness. Obviously, he's an exercise science professor. While I was in California and getting into the group fitness, I loved it so much I went back and got my master's in exercise science because I love knowledge and I'm a nerd. So I had to learn more, right? I wanted to learn how the muscles moved. I wanted to learn why we're doing the moves that we're doing and why did they choreograph it this way and all of that kind of thing. So, so during that time frame, my thought process of CrossFit and what I knew of CrossFit was go until you rip your spleen out. Like crazy people that do crazy things, and there's no need for the movements that they do, and it's not good for the body, and how could anybody like CrossFit? That was my thought process.
Well, where'd you hear that from?
Just the general population and just what I had heard in the exercise science community. It doesn't really have a great rap. It really doesn't. And I'm really sad about that because I wish I wouldn't have heard that because I love it so much. I wish I would have found it sooner. It's not true. I think maybe in some gyms that might be a true thought process, but finding the right box and finding the right coaches is really important. But you can say that about anything, right? Finding the right grocery store is really important. Like you can say that about anything in life. So it just has been such an amazing experience for me because I feel like I've been able to learn more about my body, really focus on more of what I need. When I started coaching and instructing Les Mills, I stopped again taking care of myself so much. Like I was pretty physically active and fit and all that, but I was more focused on my participants, right? And the people present, again, being that nurse in me, trying to take care of people and motivate them, that I stopped really like motivating myself. So finding CrossFit and really focusing on me and what I needed has been amazing. So, and I've learned a lot. So falling off of a bar and breaking your elbow does a lot of interesting things. And that's one of the reasons why I know you guys.
Accidents happen.
Yep, for sure. For sure.
So what's something that you've learned that you wish people knew or that you wish you knew sooner?
I think it's more so what I was just talking about is really paying attention and learning your body and taking care of yourself. I've said it for years, and I don't know if I just didn't pay attention to it, but your health is everything. If you don't have your health, you don't really have anything. And so taking that time to focus and understand what's going on in your body and take care of yourself is so important. And it really will open so many things more in your life because you'll be able to take care and provide more motivation to other people, provide more to other people if you are good in who you are.
I love that. And so pediatric is kind of your passion here. And is there something that you wish, like you commonly see that you wish whether parents knew more about, or maybe even the nursing staff that you treat, and just like things that you, in your daily work and career path, like what's something that you're like, all right, do more of?
I guess that's a really hard question. I think taking care of not just the patient, but the family as a whole is really important in pediatric medicine. And sometimes we forget because they're so integral in the care. It's very different than adult world, where that's what I call adult medicine, is adult world, where it's the patient and you're really focusing on the patient. I mean, you care about their family somewhat, but more so the patient. But in the pediatric world, you really have to focus on the care of the family too, not just the patient. So really understanding that thought process and understanding how to communicate with people is really important. I learned a lot about communication, which we talked about earlier, through flight medicine, but really continuing to work on that, because being able to communicate with different types of people is really important, and being able to understand how to read communication signs from other people is also another skill all in itself.
So what's something you've been working on, whether it's professionally, personally, physically, or mentally, that you're excited about?
Something I've been working on. So professionally, I just sat for a national exam, so I'm really excited about the nursing professional development exam that I just passed. It's all to do with nursing education and really being able to build good programs and provide great education to nurses in general. So super excited that turned out well. It was a very long exam, and I had to wear a mask during it, which I was not pleased. That made it a little bit more uncomfortable. But anyway, it's beside the point. So I'm really excited about that, and just excited about everything that's going on right now in nursing education for me and what I'm involved in, and really trying to grow the next generation of nurses is really a passion of mine. And then personally, just working on my fitness and really just understanding what's going on with me and what I need to do, and really focusing on form and function when I'm in the gym is really something I'm trying to do.
Excellent. And what would be something you'd like to leave listeners with?
I guess just really pay attention to what you need. Be able to take care of yourself, be able to focus on something that you're passionate about, because when you find something you're passionate about, it just spills over into other things. So if you feel good about life and you focused on doing something that really makes you happy, then everything else just falls into place.
And how can people find you?
Well, I'm on Facebook and on Instagram, and then I am usually almost every day at Nevada Fit St. Rose, so you can find me there. But yeah, just reach out. I love to talk about anything nursing related, anything fitness related, food too. I love food, so we can chat about food anytime. So yeah, that's about it.
Always.
All right. Well, we appreciate you. We appreciate your knowledge. We appreciate your drive to be better. Thank you for being on our show.
Thanks, guys. It's been fun.
We'd like to thank you for listening to La Vida Las Vegas podcast. We hope you enjoyed the time with our guests as much as we did. It would help us out so much if you could share, subscribe, or review our podcast, or any combination of the three. Thanks again, and remember to take care of yourself.